Welcome to the 8th video in our virtual Grant Round series here at Teachers College, Columbia University. In this video we focus on the importance of learning the adaptive, effective responses of acceptance, respect and empathy when we are interacting with those who are diverse and different from ourselves.
We explore the question, who are you? With the focus on the word R, where the A stands for acceptance, the R stands for respect, and the E stands for empathy.
So, when I ask the question, who are you, as a healthcare provider, I am asking you to consider to what extent you are experiencing the adaptive effective responses of acceptance, respect, and empathy in your work caring for LGBT and MSM patients.
Acceptance, respect, and empathy, as you may recall, are examples of adaptive effective or adaptive emotional responses to the diversity or difference we encounter in our patients.
Let's start with the letter A in the word R, or acceptance.
Acceptance is very important.
The days of tolerance are over. Who wants to be just tolerated? I think all human beings want to feel more than just being tolerated, especially by the person delivering healthcare treatment to them.
Caring for someone implies experiencing something much more than just being tolerated while in the consultation room.
It is true that tolerance is a very basic, or a very low level of response to someone who is different. Perhaps, tolerance is the very lowest of acceptable responses.
We might decide to just tolerate, or ignore, or leave a person alone. It can be a legitimate response to some people who are diverse or different from us.
But, as healthcare providers, we are supposed to strive for more than a very basic, or a very low level of response to someone who is our patient. We are supposed to care for them as a healthcare provider.
So, we need to meet a much higher standard than just tolerance when we work as healthcare providers.
Patients who enter into our care do not want to be tolerated. They want to be accepted.
We have to go way beyond tolerance.
We have to strive to feel genuine acceptance of those who are members of the LGBT and MSM cultural groups.
You do not have to personally believe in certain cultural group practices, beliefs, or traditions.
You might not choose to engage in the practices of those who are LGBT or MSM. And that is okay.
However, the goal for those striving to be culturally competent healthcare providers is to move beyond tolerance and to achieve genuine acceptance of our LGBT and MSM patients.
To accept a patient for who they are, what they believe, and what they practice is an important first step.
Next, when I ask, who are you? I arrive at the letter R in the word R. The letter R stands for respect.
Respect is actually more basic and fundamental than acceptance. So, respect should actually come before acceptance.
First and foremost, we should all respect each other, as well as respect what someone chooses to believe or practice as part of their culture. Often we respect something that we may not understand and accept.
We respect what represents someone else's beliefs, practices, or traditions.
To respect something means that we do not harshly judge it, criticize it, or condemn it.
For example, for Black men, respect is very important. They want to be respected, even if they sense that someone will never take the next steps and actually accept them, or have empathy for their experiences.
So, respect is more basic and fundamental than acceptance. Some of us may struggle to accept some beliefs, practices, or traditions among those who are LGBT or MSM. Our religious beliefs or personal preferences may interfere with our ability to enter into a state of acceptance.
However, we should feel genuine respect. People can feel when they are being disrespected. And they can feel when they are being respected. So, we have to feel and show genuine respect when we work with LGBT and MSM patients, and with all diverse patients.
Again, respect goes way beyond tolerance. The goal is for a patient to feel genuinely respected by us all, as healthcare providers.
Ideally, when I ask, who are you, going back to the letters R, you can respond by saying that you are someone who can feel genuine acceptance and respect for patients who are LGBT and MSM. Next, when I ask, who are you, going back to the letters R, we finally arrive at the letter E. E stands for empathy. When we feel empathy for another, we use our inner self to tune into what another human being is feeling inside.
We use our inner self to attune to, or tune into, what another person's inner self is feeling. That is how we achieve a state of empathy.
The goal is for all of us to be the kind of providers who can also feel genuine empathy for what our patients are feeling. If we have empathy, then we can tune into our patients and sense what they feel.
We can sense and feel when they start to feel uncomfortable, embarrassed, angry, upset, hurt, disrespected, or discriminated.
Through our empathy, we may only sense that there is some inner discord or discomfort that our patient is feeling.
What we are sensing may be enough for us to stop and ask what is happening with the patient, or what just happened during our interaction with the patient.
We can check in with the patient and ask them how they are feeling, or what they are thinking. Again, making sure we are emanating feelings of genuine respect and acceptance as we ask this question.
We can stop and reflect. We can think about whether we just did or said something that might have been offensive, or stereotypical, or stigmatizing.
We could start over again and apologize. We could ask the patient what terms they prefer for us to use, or what words make them feel more comfortable.
All these possibilities follow from feeling genuine empathy and learning to attune to what our patients may be feeling inside.
So, who are you?
Remember that the letters A, R, E stand for acceptance, respect and empathy.
And, remember the goal, that we can answer that question, who are you? In the following manner, I am someone who is striving to feel genuine acceptance, respect, and empathy when I am treating LGBT and MSM patients.
Genuine acceptance, respect, and empathy become the foundation for delivering treatment to LGBT and MSM patients in a way that reflects our striving to attain cultural competence.
In fact, if one can consistently respond to diverse and different patients with acceptance, respect, and empathy, then the case can be made that one has achieved a core component of cultural competence. Thank you for joining us.